This is Front and Center Focus for Joshua Sharfstein of Johns Hopkins Bloomberg School of Public Health. It's 1,900 people, I believe, little children, hospitalized. Do they get sick the same way we get sick, or is there something unique to pediatric hospitalizations?
Generally speaking, kids get the same kinds of complications that adults have, but they are also admitted for this condition of an immune response to the infection. So it could be a mild infection, and then they get this immune response that can be quite serious. So it's sort of what adults get plus some for kids. It's still a smaller number than adults, but the number's been rising so quickly. We're at the highest number of new pediatric hospitalizations a day ever, and it's almost a third over the previous high from January. And that's why intensive care units and hospital beds are filling up across the South right now.
What is holding the authorities back and experts and smart people from allowing for a vaccine for those under 12?
Well, to me, the frustrating thing is we don't know the answer to that. I think it would be very helpful for the Food and Drug Administration to be a bit more transparent about the situation. There have been studies of kids 5 to 12. There are reports that those studies now are going to involve more patients, which could be a completely reasonable decision, but it hasn't been the case that the FDA has really explained its thinking. And I think parents really deserve to understand what's going on. I really hope that the agency can come forward with a full explanation and a timeline for younger kids.
Professor Sharfstein, in the meantime, there is a deep sense of demoralization that you're feeling across the nation as people start to realize that this pandemic is not going to end anytime soon. And there obviously is a lot of question about herd immunity, which Tom Keene has been raising, and rightly so, for a long time, about whether it's an even achievable goal. How much have we been set back? In other words, how much more of the population do we have to get vaccinated in order to get back to some semblance of normal, or is that off the table?
Well, the Delta variant has absolutely changed the story here in the United States, and it's really become apparent how much that is the case, how different things are. I think that this would have been a very quiet summer, but for the Delta variant, and it would have been like people like me on TV going, get vaccinated because the fall could be worse. But instead, we have summer being an enormous challenge. And like I said, pediatric hospitals acting like it's the middle of winter, the absolute peak of the season. And it's August and schools haven't even opened. So it's demoralizing, but we have a danger right in front of us. We really have to, be careful for, and school systems have to make the right decisions. We have to saddle back up and go out to do battle against the pandemic again. I do think that on the other end of this surge, we will have other chances to keep this to a much more manageable level. And the most important thing is that the vaccine is highly effective against the Delta variant. So vaccination still looks like the best path forward.
Are we starting to see the surge wane the way that we have, for example, in the United Kingdom?
I haven't seen like a great sign of that yet. I've seen many news stories suggesting that over the last 3 weeks, but I don't know. I think we're going to have to really see what each week brings. And, I'm worried about other parts of the country that just haven't been hit as hard as the South.
Dr. Sharfstein, Richard Haas was just on Afghanistan, and he talked about how the U.S. can reassert itself internationally by exporting COVID vaccines. If we export COVID vaccines to other parts of the world, are we taking vaccines away from Americans?
I don't think so, because we have so many vaccines right now. So I think there's plenty of room to do both. I also think the U.S. can help other countries set up manufacturing for vaccines and really start a program for manufacturing for vaccines. And I think that would, signal just an incredible type of partnership for the U.S. to go into with other countries to really help them be able to vaccinate themselves over time. So I think there are a lot of opportunities in foreign policy here.